Hey guys, welcome back to my YouTube channel. Hope you guys are doing great. In today's video, I'll be talking about umbilical cord prolapse. But before we do that, please, if you are just coming into my YouTube channel for the very first time, please subscribe and turn on the bell icon so you won't miss any of my upcoming videos. Okay, thank you all for doing that. So what is umbilical cord prolapse? Umbilical cord prolapse occurs when the umbilical cord descends through the cervix alongside the presenting part of the fetus or below the presenting part of the fetus in the pelvis. And this normally occurs with the presence of rupture of membranes. When this occurs when the membranes are intact, this is not considered an umbilical cord prolapse. This will be considered a cord presentation. So I'll be talking to you all about the two types of umbilical cord prolapse. The first type of umbilical cord prolapse is the occult or the incomplete umbilical cord prolapse. In this case, the umbilical cord descends through the cervix alongside the presenting part of the baby. And in such a case, the umbilical cord does not go below the presenting part in the pelvis. And moving on to the second type of umbilical cord prolapse, which is the overt or the complete umbilical cord prolapse. In such a case, the umbilical cord is lower than the presenting part in the pelvis. Now let's talk about those factors that can put a pregnant woman at risk of having umbilical cord prolapse. The first factor is breech presentation. Breech presentation is when the baby is presenting with presenting with the buttocks or with the leg. This is what is known as breech presentation. And in such a case, this can put the woman at risk of having umbilical cord prolapse. The second factor is the artificial rupture of membranes. The artificial rupture of membranes is when a midwife intentionally bursts the baby's water in order to augment labor. But this can put the woman at risk, especially when the presenting part of the baby is still far up. That's when the presenting part is not applied to the cervix. So this is not advisable for midwives to do. So it's not advisable for midwives to rupture membranes when the presenting part of the baby is still far away from the cervix. And the third factor is prematurity. Premature babies who are not up to 37 completed weeks are at risk of having umbilical cord prolapse because there is space for the umbilical cord to easily slip past the presenting part. And the fourth factor is about polyhydramnios. Polyhydramnios is when there is excess amniotic fluid. So this can also put a pregnant woman in labor at risk of having umbilical cord prolapse. The reason why umbilical cord prolapse is considered an obstetric emergency is because with each contractions during labor, the presenting part, be it the head or the buttocks of the baby, mounts pressure on the umbilical cord. So this will cause insufficient supply of blood and oxygen to the baby. So this can lead to the death of the baby. Now let's move to the management of umbilical cord prolapse. The first thing after a midwife diagnoses an umbilical cord prolapse, the first thing he or she should do is he or she should shout for help, because we are going to need teamwork to remedy this situation. So we are going to need someone to place in a large ball of IV line. We are going to need to place the woman in the knee chest position. This is so because placing her in the knee chest position will help to elevate the baby's head, so the baby's head will not mount pressure on the umbilical cord. And the midwife can also do a vaginal exam to help elevate the baby's head with her fingers. So her hand will remain in this position until the woman gets to the theater and an emergency cesarean section is done. So this is it about umbilical cord prolapse, the risk factors, and some of the methods of management. So guys, I hope this video was helpful. Please comment below and tell me what you think. And don't forget to like my video, subscribe, and turn on the bell icon so you won't miss any of my upcoming videos. Thank you all for watching. May Jesus Christ bless you all abundantly, and see you in my next video.